So, bilateral same day surgery essentially refers to having a surgery conducted on both eyes on the same day, typically in at the same sitting. So, the patient comes into the operating theatre, has a procedure performed on one eye, and then straight afterwards has a procedure performed on the fellow eye. So, that is bilateral or both eye surgery done on the same day. So there's been quite a lot of research around the risks and benefits for bilateral same-day surgery. And generally, overall, the risks are exactly the same as if you were to have single eye surgery performed on the same day. So the benefits are faster visual recovery. So patients who might be time constrained, they may want to have both procedures done at the same day. They may have a quite large prescription, meaning that if they only had one eye done at the same and then another eye done at a later time, there would be quite a difference between the two eyes, meaning they're imbalanced, and so they may elect to simply have both eyes performed on the same day. That's certainly a benefit. And I often have many international patients contacting me saying, I'm actually only around or in the UK for a short period of time. Please, could I have the surgery done and therefore recover quickly? So there are certain advantages towards that. In contrast, we treat the operations as entirely separate, meaning that patients are in a sterile environment. The risk of infection is exactly the same as if they only had one eye surgery performed. We have a completely different setup when we do one eye and then we go on to the other eye. So we treat them as two completely individual procedures. So the infection risk is exactly the same as if they were to have only one eye operated upon. In terms of having bilateral same-day surgery, of course, we always consent patients for all the benefits that they're likely to receive, but also there are small risks with cataract surgery that I talked about previously. Unfortunately, should that happen whilst first eye surgery is performed, I normally would then not recommend going on and doing second eye surgery on the same day if there was, for example, a rare situation of a complication. So that's the only consideration to have, but otherwise bilateral same-day surgery is actually very safe. So typically patients who may be good candidates for bilateral same-day surgery are fit and well patients who would have a good support network at home, for example, to help them manage with eye drops, help them manage with the treatment immediately afterwards. They don't have much in the way of pre-existing conditions, for example, with mobility problems or other medical problems, which may mean that they need additional help after surgery. Patients who might have a large prescription, so for example, patients who may be very short-sighted or indeed very long-sighted, as we may be aiming to change their prescription quite radically. And if we did that only in one eye and then left the other eye for a few weeks, there would be left with quite a bit of imbalance between the eyes. That can result in headaches and difficulty with what we call depth perception or navigating around. And therefore, those patients are often good candidates to go and have surgery with both eyes done at the same time. There are other medical conditions that affect the eyes, such as glaucoma, which is a condition affecting the optic nerve that can result in sight loss, and similarly, age-related macular degeneration. These conditions, depending on the nature and severity of them, may mean that patients may not be suitable to have both eyes done on the same day. So they may not be candidates for bilateral cataract surgery. So the pre-operative preparation is actually very similar to patients having one eye surgery. It involves us doing a series of measurements, which are called biometry. Now, if a patient has a high prescription, they may be wearing soft or hard contact lenses, and typically my team at the Grosvenor Eye Clinic will discuss directly with patients as to how long they need to be off or not wear contact lenses prior to the biometry measurements. And that's really because we want to get the surface of the eye to assume a very normal shape. And that might pose a problem, obviously, if they're wearing a contact lens in one eye or both eyes. So there's a slight difference there between that and the case of someone having one eye surgery, in the sense that we would ask them to not wear contact lenses in both eyes for a period of time prior to the biometry measurements. Other than that, The preparation for surgery is very, very similar. On the day of surgery, we often use medications to dilate the pupils in the eyes to therefore get access to the cataracts. Now, of course, when one has one eye surgery, we only dilate one eye, but of course, when we're dilating both eyes will be prepared at the same time, which can result in blurring. And so often patients might need a little bit of assistance coming from their preoperative room on the ward before they come into the operating suite ready for surgery. And similarly, afterwards, they need to be aware that temporarily the vision will be very blurred in both eyes immediately after the operation. What I often recommend for patients who are having bilateral same-day surgery is to actually give themselves a little bit more time in the recovery suite after surgery, just so that the vision can start to come back a little bit more and they're able to start to navigate or feel more comfortable when they go home. I also recommend with all patients, but particularly with patients having bilateral same-day cataract surgery, that they have help, have an individual with them to take them home and help be with them at least for the first 24 hours whilst the eyes are recovering following the immediate surgery. So the first thing to do is simply to get in touch. There are a number of ways of getting in touch with me via my team and also through the Top Doctor's website to arrange a consultation. When evaluating patients for surgery, I discuss the options very carefully with them, and if they do have an interest for bilateral same-day surgery, just to make that very clear. We go through the risks and benefits in detail with patients, and as I say, discuss the need for them to have some additional support following same-day surgery at home, at least for the first 24 or so hours. And then in terms of biometry measurements, plan for their prescriptions and also plan for the abstinence of contact lens wear prior to the measurements.